So I'm here with Dr. Howard Kaufman from the Rutgers Cancer Institute of New Jersey. Dr. Kaufman, thank you so much for joining us at ASCO 2016.
Sure.
So you just announced some really exciting research. Can you tell us a little bit about this research that you've been involved in?
Yeah, so we've been looking at a disease called Merkel cell carcinoma, and it's a rare form of cancer, but it's one of the most deadliest forms of skin cancer. If this disease becomes metastatic, it's actually deadlier than melanoma. It responds a little bit to chemotherapy and to radiation, but long-term survivors are very unusual with this disease. So it's really been kind of an orphan disease for a long time. What's exciting is we think that it's amenable to treatment with a form of cancer therapy called immunotherapy. And work that was done recently suggested that the Merkel cell cancers may express a protein called PD-L1. And there are several agents in development that target PD-1 or the PD-L1 pathway. And this is really one of the first studies to use a PD-L1 agent that really blocks that target and helps to turn the immune system back on. And so in this study, we actually screened 125 patients with advanced Merkel cell carcinoma. And these were patients who had already had chemotherapy and failed it. So this is a very difficult situation. And what we found was that 32% of the patients had an objective response. An additional 10% were stable, kind of in remission. And at the time of the analysis, which was about 10 months into the average follow-up, 80% of the patients were still responding. And so we think this is going to translate into really long-term durable responses, which will be the first time that's happened in this disease.
That's really exciting. And I was reading in your press release that went out earlier today that currently there is no standard of care for this type of cancer. And so when you think about the impact that this research has on patients, and it's suggested that patients with this form of cancer enroll in clinical trials. So do you think that this can now potentially develop a standard of care for patients?
Yeah, I think so. The current standard, as you suggest, is to participate in a clinical trial. There are some chemotherapy regimens that will give us some initial response rate, but haven't been associated with overall survival benefit. I think this will, in fact, change the standard of care, and this also comes at a time when there's another clinical study using a PD-1 targeted agent in first-line therapy that's also shown over 50% response rate. And so I don't think we can ever have too many effective agents for patients. Another important point of the study was that we looked at the safety of the agent. And we really found that the treatment was fairly well tolerated. There were no deaths. There was really only one case of a grade 3 adverse reaction. Most of the side effects were low grade, relatively easy to manage. Fatigue and an infusion reaction to the intravenous administration were the two most common things that we saw. You can get these immune-mediated adverse events that have been seen with other T-cell checkpoint inhibitors, but again, the incidence was rather low, and these were generally of low grade when they did occur.